and I'm sorry, I believe it is Joy Austin. Mr. and Ms. Austin, if you're here.
I was happy.
Okay. Well, I want to apologize because I didn't know male or female, Joy, so.
Either way.
That's another committee hearing.
It's a long conversation,
It's a whole other meeting.
I am Joey Aston. I'm from Forest City, Arkansas. I'm the director of the St. Francis Area Developmental Center. I'm also currently serving as the president of the DDPA, Developmental Disabilities Providers Association, which my good friend Randy Lafferty was our initial executive director back in 2001, so it's great to see Randy as well. We had a board meeting today, and I told our board members and those present, if you're asking me to go speak about the HDCs on our behalf, you will not get me to say anything to the detriment of the HDCs. Everybody in the room was in agreement that we do that we continue to support. And I'll step away from my role for a minute as executive director and president of DDPA. Interestingly enough, 31 years ago this month, I was in phase training right here at Conway Human Development Center. Worked here 3.5 years. And Sarah, I walked my phase training today, and Roy Johnson's still in there doing phase training. So the same guy, so I was able to step in and visit with some of the folks coming on board. But more importantly, when I was here, we had a young man that lived in 28-seater, if you're not familiar with the campus. He had a lot of medical issues, needed surgery at that time, needed a guardian to sign off on those medical issues. He didn't have one. He was from Madison, Arkansas, which is just outside of Forest City. So we called my mother, and she agreed to do it. After I left here, his condition became such that somebody was going to maybe have to make an end-of-life call. My mother could not do that. And asked me by that time if I would agree to be the guardian. I didn't work here, so I could. So I had Willie. By that time, he had left the Conway Human Development Center. He moved to a Pathfinder. I see Dusty Maxwell over there, facility at Searcy, the Longwood ICF. His health deteriorated as such. His spina bifida, chronic renal failure. He ended up down in Children's, and it was probably, according to the doctor's, time to make that call, but through nothing short of a miracle. And the doctors there would tell you the same thing. They did nothing to cure him. A miracle cured him that time. So we had left the 10-bed. We were at Children's. We needed a place. So we found another home for Willie at the Jonesboro Human Development Center. I see my friend Forrest Steele over here. And if you don't know, Forrest started at the Conway Human Development Center as well before I did. He looks a lot younger. He was a child when he started. So we were fortunate, and so and I want you to follow me because my point is how important both community-based programs and the HDC are to each other. I've heard a lot of talk about that, and they are important. There's no divide that I'm aware of, and I think Randy and Senator Malone worked to fix that divide years ago within our association, that there may have been some divide. But if you follow the course of Willie's life, he went from a human development center to a 10-bed with Pathfinder, Children's for several months, to the Jonesboro Human Development Center for several months, and maybe a year, I'm not real sure. And then eventually he was able to transition out of the Jonesboro Human Development Center to our friends in Jonesboro Abilities Unlimited, and live in an apartment of his own with direct care, 24-hour direct care staff, until that time that he did ultimately pass. I did get to make that call. With the doctors, I was not there, but really was more importantly surrounded with the people that served him. The people from the Abilities Unlimited, his direct care staff. Some of those staff came from the Jonesboro Human Development Center. And that became his family. He was really fortunate all those years to have an HDC family, a Longwood family at Searcy, the Jonesboro Human Development Center family, and then ultimately an Abilities Unlimited family. So my point is that's how important we are to each other, and I want you to know that was back at 85 to 88. So with Willie, I was gone, and from here in 88, so around 1990, 91 when that happened. Well, let's fast forward a few more years to just a year or so ago, and I'm back as a director now. We had a guy that was in our program. He lived in one of our 4-bed congregate settings. He wanted to move back home, and everybody was in complete agreement that that's what he did. He was in Forest City with us. He moved back out on the waiver with family and friends up in Portia, Arkansas. It's outside Walnut Ridge, if you're not familiar with the area. At some point along the way, Tim presented some behavioral health issues, as such that the family there could not handle them. It wasn't at a point where we could bring them back into one of our congregate settings, so he spent a little time in a behavioral health facility. But again, we looked to our friends at the Jonesboro Human Development Center, and Forrest and his staff did an absolutely fantastic job getting Tim's medication in line, assisting with some of the inappropriate behaviors that he was exhibiting. And I'm proud to say now, Tim is back. He's back with us. He chose us as his waiver provider. He's back in Forest City, but he's not in the 4-bed congregate setting, but he's in an apartment with staff, with direct care staff. So again, I think it's just important to note and for everybody to remember that I heard someone mention a while ago that we are intertwined, and indeed we are intertwined. We need each other at this point. I mean, this is what we have, the system that we have, and I think for some of our people it works extraordinarily well. Certainly for some of the families that are in this room and around the state, the HDC setting works extraordinarily well for them. I spoke to some of the parents, and somebody used the word earlier. You don't look at Conway as from working here years ago. Those of you that are older would remember it was called the Children's Colony. It's not a colony. It's not an institution. It truly is it's a community for these people. I was able to walk across campus when I got here today. I ran across a friend of mine that still works here from the 80s. That works here, and another friend of mine that still lives here. Ricky, I won't say his last name, but and you know, we had an impact on each other. When I spotted him, he knew me, and when he spotted me, he came running over to me. So I think those relationships you build are really important. And maybe I'm not, for our organization, the best CFO, because all of our conversations at my work, all of our conversations now at DDPA, and Alyssa's a member of our organization, revolve around not so much the dollars and cents. If we're going to start a discussion, we start discussions about how best do we serve our people. I mean, sometimes I know it's more difficult for you in the legislature to do it, but we have to figure out ways to back into how we're going to cover the cost. We've had people in our program. We've had one young lady that was on the waiver waiting list, had absolutely nowhere else to go. She wanted a group home placement. We served her, I believe, 5 years unfunded while she was on that waiver waiting list. Now, I'm not saying that to pat myself on the back. I'm saying that because that's what she needed. She had no other options. But her number did come up, so to speak, but it did take a while, and that is problematic for all of us, and I know it's a cost problem for you guys to deal with. Just quickly, I'll tell you the scale of what waiver plans cost our agency in the state, not cost our agency, but what we're funded. We have one young man that's on a pervasive level of care, and he's only one. His plan is just under $96,000 a year. In our congregate setting, our lowest cost female